Hello, this is Dr. Gay from First Leg MRI, and this is a 73-year-old female with complaints of left upper chest pain, and they did a chest x-ray just to make totally sure there's nothing going on, and this is the left lung, looking great. This is the right lung, also looking great. Here's the heart in the middle, and so they ruled out pneumonia, ruled out a pulmonary nodule. The pain was up in this region here, and they were worried that they may have sternoclavicular arthritis, and on chest x-ray here, you see the clavicle coming across. It ends right here. This is the sternoclavicular joint. It's just very hard to see on x-ray, especially a chest x-ray. A dedicated x-ray here will show this a lot better. This is the right clavicle coming across, and the right sternoclavicular joint is completely obscured by the spine here. So you can see how hard it is to evaluate for arthritis just on a standard chest x-ray. So the patient did get an MRI here, and sure enough, they have arthritis. It shows up a whole lot better. So this is called a T1 weighted view, where the clavicle has bright marrow signal because it has fat. You can see all the bright fat around everywhere else. This is the sternum in the middle. We see these dark bands. These are the cartilaginous portions of the medial ribs. There's bone here, and then it turns to cartilage. So we call this the costochondral cartilage. You can see the same thing over on this view. On this view, everything is dark except for fluid or inflammation. We see that as bright. So we see there's fluid in this joint. This is the sternum clavicle, so they call it the sternoclavicular joint. And here on this view, we don't see fluid as bright. It looks dark. But we see these bone erosions a little bit better. So this is a bone erosion of the medial clavicle, a bone erosion of the sternum. And on this side, we see the marrow edema, which is bright, and the clavicle and sternum. But those bone erosions don't show up as well. Part of this darkness may also be marrow edema, but the little cortical erosions really are almost invisible on this. And we see the ligaments going around the joint. The top ligament's a little bit thick and a little bit of bright signal on it. So this is a case of moderate left sternoclavicular degenerative arthropathy with a joint effusion and reactive marrow signal changes, and this is what is causing their pain. And the right side here looks nice and normal. Clavicle comes across. The end is sharply defined, nice and clean, nice joint. You can see the same thing here on the T1 view. So a case of left sternoclavicular degenerative arthropathy, and that was the cause of their pain. Thank you very much.